So today we're going to be talking about the different types of labiaplasty. So there's two main types, and we're just going to sort of break it down. Hello everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita and I've got my dear friend and co-host Dr. Amalfi here with me today. Hi girl.
Hi babe, how are you?
I am great. I'm so excited about our series that we're doing all about labiaplasty. So good. And I mean, so good. So today we're going to be talking about the different types of labiaplasty. So there's two main types, and we're just going to sort of break it down. Of course, in true like Ashley Smita fashion, we sort of do one of the two the majority of the time. But we're going to sort of talk about it because all that information is out there, and most of you, if you're anything like my patients, have done your research before coming in to see me. So it's good for us to sort of talk about it. So Ashley, what are the two main categories?
So the two big ones that you hear people talk about are wedge and trim. Mm-hmm. And so I'll talk about wedge first. Wedge is, essentially just like it sounds, you're taking a wedge of tissue out of the labia minora, kind of like a pizza shape or a triangle. And then when you remove that wedge, you bring things together. So you end up with a suture line, and that kind of shortens and tightens at the same time. A lot of people do wedges. I think they're really awesome. In my hands, I didn't have as good of a time with patient healing, so it's not something I do a lot. It's not something I would say I never do, but I'm much more of an edge person. I do a lot more edge excisions, but the wedge is super reasonable. It does cut through some of the vessels, so you want to make sure that you are a super healthy candidate if you're having a wedge. This is something where like smoking, vaping, even smoking marijuana could affect the blood flow there, diabetes, anything that affects your circulation might make it a little hard to heal after a wedge excision. So you want to be careful if that's what you're having. Make sure you're a good candidate for it. But the wedge is just that triangular piece that's cut out and everything comes together and is tightened. But I'm a much bigger fan of the edge trim, and I know you are too. So why don't you tell people about that one?
Yes. So the edge is essentially just a trim, right? It's whatever, if you can imagine, if the excess is sort of protruding, you literally just trim that excess off. And so you have one suture line at the edge, and it can remove the excess and sort of make everything uniform with the front and back of, sort of the anterior and posterior. So it's, one even area. But similar to you, I think that is just a very straightforward procedure. Everyone, for the most part, I haven't had any healing issues with my patients with that.
Yeah, it's great.
It's easy and quick. And so that's my preferred technique. But as you said, every surgeon will have their preference, based on your anatomy or just based on what works best in their hands. So both are great procedures. In either scenario, you do want to make sure that you're healthy. Obviously, for the wedge, it's going to be a little bit more important because you are cutting through some of those blood vessels there.
Right.
But you also want to make sure you're seeing a board-certified plastic surgeon or even an OBGYN that specializes in sort of these labiaplasty procedures. So make sure you're going to the right people.
So such a common question. I hope you guys kind of understand the difference between the two. There's no right and wrong, but you want to ask your doctor, what technique do they use and why? And another thing to really ask is how often are they doing them? Are they doing like one a year? Or one a week, or one a day. Those are very different. And then you want to ask them about, what kind of complications are you seeing, and are you happy with those results, and what should I expect, and all of that. And so I think just understanding the difference with those two is going to help you be prepared so that when your doctor talks about what technique he or she uses, you just get it. You just understand, and it's just going to help you be better educated so you have a better experience and are ready for your healing process.
Yeah, That sounds perfect. I
Awesome.
love these little episodes. I know. They're like
It's
quick,
great.
straight to the point, but it answers like such amazing questions, important questions that
You guys have to probably
need
be learning
answered.
so much. Take notes, learn a lot, press
Take
repeat.
notes.
Yes.
I know.
And subscribe because there's so much more to
Yes.
learn. So we have more to come in this series. Make sure you're subscribed so you're catching the latest lipstick and lipo. You're educated about all things plastic surgery by 2 board-certified plastic surgeons. So we're excited to have you. Stay tuned for more. And I will see you soon, Smita.
Bye. See you guys next week.